One of the things that we know is that across all the population in this country, the mental health of our young people is getting worse. We've now gone from 1 in 10 young people under the age of 18 with a mental health problem to 1 in 8 young people experiencing a mental health problem now. We also know that the vast majority of young people's mental health problems can then become more serious conditions in adulthood if you're not properly treated, you don't get the right help and support. We also know that young people, although their attitudes are more positive towards mental health, are hungry for information. And most of the information that they kind of currently access has been written to them. It's been written for them, but it's definitely not been written either by them or with them. And so one of the really important parts of this programme, and I'm so delighted that Bupa is going to help us make this happen, is to sit down with young people and work together to use the right language, the terminology, the tone of voice that helps people to see that, yeah, mental health is something we can talk about, and also this is what you can do to spot the signs of a developing mental health problem, and critically where you can go for help and support.
I mean, one of the things that really drew me into this partnership, which I think is fantastic, is I really think it's important that we do some stuff that's practical, it's pragmatic, that's useful, that's relevant. And so some of the things which I really pull out of that, I think the fact that we're putting together resources which can be accessed very easily in terms of online access for people, the fact that it's going to be sort of co-authored by having people who it's relevant for to contribute to it, not written by people like us who's sitting in an office somewhere thinking we'll have a go at it. Actually, we're going to get it in the language that people want to read it in, and therefore it should have the biggest impact. So I think all of that practicality is really important to us, and that's one of the advantages of using some of the resources we've got to be able to do that, because we've got lots of experience of pulling together health information. Let's try and do it in a way which is most relevant for those people.
Yeah, I think it's going to be really interesting, isn't it? Because we already work with adults at Mind, and we have done for many years, and that's the way we've always structured our information work. And of course, we know we're very trusted by the public and by people with mental health problems who really see us as an organisation to go to. But we haven't really explored enough the way in which we can translate that into working with young people. And I think we're really looking forward to working with you to think about how we can explore that and help and support young people to really have a real voice in this area.
It's a great opportunity.
Absolutely.